so often I actually have people come to me and say, well, so and so who ordered this for me told me I have H. pylori. And then I started taking all these crazy things to kill off that H. pylori. And now I have severe IBS. I have debilitating diarrhea. I have not had a regular bowel movement since. I have the worst gut hypersensitivity. So again, no matter who's ordering it for you, you really want to get an understanding of how familiar are you with interpreting this test. So it's not just who can order it, it's who can properly interpret it for you to really assess who should be living there and who shouldn't. And, we do know that there are so many things that play into, again, who moved into our gut apartment? Was there any influence of antibiotics? What did that look like for you in your entirety of your lifetime? Have they been very sparse, maybe less than a handful of times? Or has it been a handful of times every month for you since you were born? You want to understand what has been your exposure to pesticides, whether you're someone handling pesticides, because again, your skin is a medium for things to get into your gut, or is it just consumption of pesticides? Because as James mentioned, any of those sides are basically killers. What has been your experience and consumption with additives into foods, especially binders, gums, and emulsifiers, because we do know those can bind to our gut bugs, whether they're healthy or unhealthy. What has been your life stress? What has your motility pattern looked like? All of these things are going to dictate how many of those either healthy tenants we have in our gut or those less than ideal tenants that we have in there who are really not respecting the space and taking care of it and honoring it. So one thing that we always ask, which we'll get into, is what's your gut health story? That's always something I ask, literally from womb to present day. I want to know, did your mom have gut issues? Because she can transmit bugs to you, even in utero. Were you breastfed? Were you vaginally delivered or C-section delivered? Were you colicky as a baby? Because now we're really understanding colic is usually gut inflammation. What else was really influencing and impacting the balance of bugs in your gut? So again, when the structure or the barrier, when the function or the motility or the flow, when the population is off, that can then lead to a wide variety of these gut symptoms. And we know that IBS is on the rise. So usually if somebody has an alteration in bloat, discomfort, and or bowel movements for multiple days a month for several months in a row, usually that collection of symptoms is then diagnosed as this disease or this disorder called IBS, irritable bowel syndrome. And worldwide, we know 1 in 7 people are suffering from IBS, and it is a little bit more elevated in the United States. We have about 10 to 15% of our population here in the US who is diagnosed with IBS. And we know it's one of the number one causes people seek out medical attention. So it's one of the number one reasons that people are seeing their doctor or finding a dietitian. We know, unfortunately, now colorectal cancer is the fastest rising cancer in those 20 to 50. So our gut is really screaming at us as a population at large. So we really need to lean in and start to understand what is causing this irritable bowel. Why is our bowel irritable? What is it trying to communicate to us? Which one of those three main components is off? The structure, the function, the population.